We're talking about the 10 warning signs of stroke. Knowing these signs could save a life, maybe even yours or someone you love. First, it's important to understand that a stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. This can cause brain cells to die in minutes. There are 3 main types of strokes. Let's start with the most common type, ischemic stroke. About 87% of all strokes fall into this category. Ischemic strokes happen when a blood clot blocks or narrows an artery leading to the brain. There are 2 main types, thrombotic and embolic. Thrombotic strokes occur when a clot forms in one of the arteries supplying blood to the brain. This often happens in arteries damaged by atherosclerosis. According to the American Stroke Association, this type is more common in older adults. Embolic strokes occur when a blood clot or other debris forms away from the brain, commonly in the heart, and is swept through the bloodstream to lodge in narrower brain arteries. This is often associated with heart conditions like atrial fibrillation. Research published in the New England Journal of Medicine highlights the significant risk posed by embolic strokes due to their sudden onset. The second type of stroke is known as hemorrhagic strokes. We have hemorrhagic strokes, which occur when a blood vessel in the brain bursts, leading to bleeding in or around the brain. Though less common, accounting for about 13% of stroke cases, they are often more deadly. Hemorrhagic strokes can be divided into 2 types, intracerebral hemorrhage and subarachnoid hemorrhage. An intracerebral hemorrhage is when a blood vessel bursts within the brain, causing blood to leak into the brain tissue. This type is often caused by high blood pressure, as described in studies published by the American Heart Association. A subarachnoid hemorrhage is when there is bleeding in the area between the brain and the thin tissues covering it. This type is often caused by the bursting of an aneurysm. According to research from the National Institute of Neurological Disorders and Stroke, subarachnoid hemorrhages can lead to sudden, severe headaches and are a medical emergency. The third type is called transient ischemic attacks, or TIAs. Often called mini-strokes, TIAs occur when there's a temporary period of symptoms similar to those of a stroke. A TIA doesn't cause permanent damage and is caused by a temporary decrease in blood supply to part of the brain. While TIAs may last only a few minutes and cause no permanent damage, they are serious warning signs. According to the Centers for Disease Control and Prevention, CDC, about 1/3 of people who experience a TIA will have a major stroke within a year if they do not receive treatment. So let's dive right into 10 signs of stroke. Number 1, sudden numbness or weakness. First on our list is sudden numbness or weakness, especially on one side of the body. This is often one of the first signs. According to a study published in the Journal of the American Heart Association, unilateral numbness or weakness is a common early symptom of stroke. Pay close attention to any unexpected changes in sensation. Number 2, confusion or trouble. Speaking. This can manifest as slurred speech or difficulty finding the right words. Research from Stroke, a journal of cerebral circulation, highlights that aphasia or difficulty in speaking can be an early indicator of a stroke. Third, sudden trouble seeing in one or both eyes. This can include blurred or double vision. According to the American Stroke Association, vision problems occur in about 1/3 of all stroke cases. If your vision suddenly becomes impaired, seek medical help immediately. Number 4, dizziness or loss of balance. Dizziness, trouble walking, or loss of balance is our 4th warning sign. The National Stroke Association reports that sudden dizziness, loss of balance, or lack of coordination are red flags that should not be ignored. Number 5, severe headache. A severe headache with no known cause can be a major warning sign. This is often described as the worst headache of your life. The Mayo Clinic states that a sudden severe headache, sometimes accompanied by vomiting or altered consciousness, can indicate a hemorrhagic stroke. Next, difficulty swallowing, also known as dysphagia. Research in the Journal of Neurology indicates that difficulty swallowing can be a symptom of a stroke, especially if it's sudden. Number 7. Sudden fatigue. Sudden and extreme fatigue is another sign. According to a study in the Journal of Stroke and Cerebrovascular Diseases, sudden fatigue or exhaustion can be an early warning sign, particularly in women. 8th on our list is facial drooping. If you notice one side of the face drooping or if someone can't smile symmetrically, it's a significant warning sign. The American Academy of Neurology emphasizes that facial drooping is often one of the first visible signs of a stroke. Number 9, trouble walking or sudden dizziness. This overlaps with loss of balance but is specifically about the inability to walk properly. According to the British Medical Journal, sudden trouble walking is a common symptom that accompanies a stroke. Number 10, nausea or vomiting. Sudden nausea or vomiting, especially when combined with other symptoms, should be taken seriously. The American Heart Association notes that this can be a sign of a stroke, particularly in hemorrhagic strokes. Remember, if you or someone you know experiences any of these symptoms, call emergency services immediately. Time is critical when it comes to stroke. Awareness and quick action can make all the difference. Thanks for watching. Don't forget to like, comment, and subscribe for more health tips and information. Stay safe. See you next time.